Hi, I'm Lisa Santoro, the massage therapist at the Lydian Center. And one of the things that happens with massage, if a partner asks you to massage them, sometimes they might be a little bit bigger muscled, or they may have some tension that your hands would get tired easily when you're massaging them. So what I'm going to demonstrate right now is how to do a little bit of partner massage with some ordinary household tools. Bagabity, if you could hold these for me. What I'm using first is a rolling pin. It's one of the best self-massage and partner massage tools out there. And most houses have one, just your ordinary garden variety rolling pin. And what I'm going to do is I'm going to be massaging Bagabity's shoulders. And what I'm going to do is I'm going to roll that rolling pin right on areas of pretty common tension. The shoulders, or trapezius as we know in muscular terms, can get very tense when people are using computers, sitting at desks during the day, or even if the partner has been caring for a child at home and lifting children, putting them into a crib. Sometimes this area can get very tight and tense. So I'm just doing some nice moderate pressure here. And in this way, using a tool, your partner can say to you, gee, could you do that a little harder, please? And all I have to do is lean on that rolling pin just a little bit more and just roll that out, just like you're rolling out dough. So that's one tool you can use. And the second tool, if I can take the tennis ball, Bagabity, thank you. Tennis balls make excellent massage tools. And for a little bit more specific pressure, we can just roll that tennis ball right on that area of tension. One thing you want to make sure of is that you're not rolling over hair or that you stay away from bony areas. So you might want to poke around just a little bit. You want to make sure that you're not going beyond sort of the sweater or shirt crease right here. That's when we get into bone. So we're going to stay in soft tissue or muscular areas. So I'm going to work that tennis ball back and forth. How does that feel, Bagabity, when I do that?
Great.
We did not pay her to say that. And so I'm just going to roll that tennis ball both sides. I'm just using the tennis ball right in the heel of my hand. It makes a wonderful self-massage tool as well. We can do this on ourselves. We can do this on our chest area. We can do it on our hands and our arms. But for doing it with partners, it's a really fun little tool to use. My favorite tool of all time, I'm just going to put that right there. Toys make excellent massage tools, especially little cars and little trucks. And it's the same concept as when you're using the rolling pin. It can feel even a little bit deeper because you have a smaller area that you're massaging with. And I'm just going to roll this little truck. How does that feel?
Whoa.
That can feel a little bit deeper. And really, you can look through your toy chests at home, if you have them, and see if one is appropriate. I'm using sort of this monster truck, but really anything with wheels, little trucks, little cars. The Hot Wheels cars are a little too small, so I'm using one with some about, these tires are about maybe 1.5 inches big, maybe 1 inch wide. And so that, again, that's a little bit deeper and can provide a little bit deeper of massage while saving your hands. And if I can use that one with the rolling. This is a specific massage tool. You can find these in places where they sell body care products. And this one it just has some smooth balls. It might not have as much of an impact as the little toy truck. And it's a little bit smoother while I'm doing the massage. Yeah, does that feel less deep? Mm-hmm. And that might be nicer for people who are they just want to relax. They just want to have a little bit of massage and maybe they don't have as much tension here. These kinds of tools can be nice. And again, you can really use these tools anywhere in the body. You can use them on legs, on arms, on your own chest, on your neck area. So they make a great household addition for some partner massage.
talk to you about simple things you can do to prevent disease and stay healthy.
So Emily, what are the leading causes of death in the U.S.?
The leading causes of death for men are heart disease, cancer, unintentional injuries, adverse drug reactions, stroke, respiratory disease, and diabetes. According to the Journal of the American Medical Association, 30% of American men over the age of 60 use at least 5 prescription medications daily. 91% of U.S. adults claim to use at least 1 medication regularly. 140,000 deaths per year are due to adverse drug reactions. To put this into perspective, the Centers for Disease Control estimated that 11,000 people died last year of swine flu, yet 140,000 people die per year of adverse drug reactions. Yes, medications are necessary, but when 91% of Americans use a medication regularly, perhaps this should raise some reflection on our ways of healthcare and that we should take some steps to make changes towards healthier living. Everybody and everything that you do makes a difference. So even if you have a medical condition, it is never too late to start.
So Emily, what kinds of things can we do to help prevent those big killers, cancer, heart disease, and the other serious illnesses?
Well, I say start the day with lemon water. Even though lemons taste sour like an acid, they actually produce an alkaline reaction in the body. An alkaline environment makes it less likely for germs or cancer to grow or for inflammation to take place. New studies show that inflammation contributes to plaque formation in the blood vessels, which lead to increased cholesterol. Lemons are also high in vitamin C, making them great for the immune system. So squeeze half a lemon into your water for a refreshing beverage.
So is soda bad to drink?
Yes, it's bad to drink. An average American consumes 150 pounds of sugar per year. Do you know how much that is? I don't even weigh 150 pounds. 1 can of soda contains 40 grams of sugar in the form of high fructose corn syrup. In a study titled Soft Drink Consumption and Obesity, they say that high fructose corn syrup in soda increases triglyceride levels, risk of diabetes, hypertension, inflammation, and can contribute to fat deposition. Any sugar that is not burned, such as an exercise, gets turned into fat by the liver. Now you say, what about soft drinks that are sugar-free or diet sodas? Well, they often contain aspartame, which can cause cancer, so stick to your 8 glasses of water per day.
And what about exercise?
Yes, exercise sometimes tends to be one of the lowest priorities for people. But I tell my patients that sometimes they really need to reframe what is important to them. If you feel well, you will often find that you have more time to do things than if you don't feel well. A study showed over a 20-year period of time that men who exercise were less likely to die of any cause. Exercise also decreases risk of diabetes, heart disease, osteoporosis, and is important for healthy weight, mood, and energy levels.
What about the foods we eat?
Well, they say that we should have 9 servings of fruits and vegetables daily.
9, that's a lot. How much is a serving?
Well, a serving is half a cup, usually. And to put that into perspective, you can have 2 cups of fruit per day or 2.5 cups of vegetables per day. And if you think of a salad, that's not so much. Fruits and vegetables are very important for health function, and I usually tell my patients what to do rather than what not to do. So eat your fruits and vegetables first. Instead of grabbing for your meat and potatoes first, where you're likely to be too full and not include any fruits and vegetables, you can have them first. And they are a great source of vitamins, minerals, enzymes, and fiber that are essential for cell function. Most people notice an increase in energy levels and mood when they increase their fruits and vegetables.
What kinds of things can we eat for healthy snacks? I know a lot of men pay too many visits to the vending machines and Dunkin' Donuts and Starbucks.
Yes, well, I tell my patients to be prepared and buy some snacks to keep at their desk or at the refrigerator at work. Some examples of healthy snacks include nuts such as almonds, celery or carrot sticks dipped in hummus or nut butter, yogurt, fruit, energy bars, but be sure to read the labels for your protein bars to not contain high fructose corn syrup. When at home, I love to have leftovers such as soups, stews, or appetizer salads as snacks. And lastly, don't let that beer belly grow. Studies show that obesity itself is a risk factor for increasing diabetes, hypertension, cardiovascular disease, cancers, back pain, to name a few. Fat that is deposited in a pattern, such as your beer belly or apple shape, is more dangerous than general obesity. I use a program called First Line Therapy with my patients to help them improve body composition and decrease cardiometabolic risk factors.
What about alcohol, Emily? I've heard that 2 glasses of wine a day can really help to fight heart disease, but how much alcohol is too much?
Well, according to the Centers for Disease Control, moderate drinking is defined as having no more than 1 drink per day for women or 2 drinks per day for men. Now, 1 drink is 12 ounces of beer, 5 ounces of wine, or 1.5 ounce shot of liquor. Studies, now men, you cannot add up your quota for the week and say that drinking 7 drinks on a weekend is okay, or in the category of moderate drinking, because drinking any more than 5 drinks on a single occasion is considered binge drinking. Studies do show that men who drink moderately have a 20 to 28% chance of dying less frequently than men who are abstainers or heavy drinkers. The cardiovascular benefits of wine are due to the antioxidants such as resveratrol, but antioxidants can also be found in grape juice or fruits and vegetables. Studies also show that moderate drinkers tend to have a lower incidence of Alzheimer's disease, stroke, peripheral vascular disease, or cardiovascular disease, and also have a decreased incidence of catching the common colds. However, alcohol can tend to raise triglyceride levels because of its high carbohydrate content, especially in beer, so alcohol can increase risk of developing diabetes. Also, since alcohol is brewed with yeast, people who tend to be sensitive to yeast can experience some bloating or gastrointestinal symptoms. Lastly, heavy consumers of alcohol are at risk for developing liver disease, pancreatitis, certain cancers, and are at risk for getting involved in accidents.
What about drinking because you're anxious or depressed?
Well, if you're drinking to relieve stress, anxiety, or depression, that should be a red flag, and you should talk to your doctor about that. Some better ways to deal with stress include going outdoors, exercising, engaging in hobbies that you enjoy, or spending meaningful time with people who have relationships with you, such as friends and family.
And what about herbs? Are there some good herbs for stress?
Yes, there are some great herbs for stress. One very popular herb that has come into being for mood and stress has been St. John's wort. However, St. John's wort is processed by the liver, where many drugs are also processed and can interfere, so you may want to talk to your doctor before using St. John's wort. FYI, St. John's wort decreases the effectiveness of birth control pills. Some gentler herbs that I like to use are chamomile, lemon balm, or passion flower. I tell my patients that they can find these in the form of a tea, tincture, or capsules. Other great supplements for relieving stress are B vitamins and magnesium.